I'm Antony Loebel, Chief Medical Officer at Sunovion Pharmaceuticals. I'm also Head of Global Clinical Development for Sumitomo Dainippon Pharma. I'm actually a psychiatrist by training and practice. I was in practice for a number of years, treating a wide range of patients with serious mental illness, mainly adults. And then I did join the pharmaceutical industry and have done a range of work in CNS, in psychiatry, and other areas within CNS for a number of years. So we're very excited to be presenting what is the first ever placebo-controlled study of a group of patients who fall into a new diagnostic category called Major Depressive Disorder with mixed features. If I can just step back for a moment and say that historically this group of patients has been very difficult to classify, and despite the fact that people have tried to carefully understand the nature of the disorder over the past several decades, we didn't have a formal diagnostic nomenclature that could allow us to diagnose and properly understand how to treat these patients. In 2013, for the first time ever, DSM-5 allowed us to do that. DSM-5 included what's called the mixed features specifier into the diagnostic nomenclature for the first time. And so we were able now to increasingly identify these patients and understand that major depressive disorder can and in fact frequently may present with manic features or a limited number of manic symptoms. Now, our trial is the first one to look at whether Latuda, which is an atypical antipsychotic agent, is effective and safe, and we were very pleased to see the results that showed Latuda has significant effectiveness in patients with this condition, and it appears to be well tolerated. This is the first study of any psychotropic agent in this condition and provides the first evidence base to guide treatment for this patient population. All the patients in this study were required to have major depressive disorder, an episode of major depression. In addition, all the patients were required to have a limited number of manic symptoms, 2 or 3 manic symptoms, which is below the threshold required for the diagnosis of hypomania. So these patients did not have bipolar disorder. They did have major depressive disorder, but with manic features, which puts them somewhere between major depression and bipolar disorder in terms of our understanding of mood disorders. It was remarkable that Latuda was well tolerated in this patient population. We saw very limited effects on weight, lipids, glucose, prolactin. There was low risk for movement disorders. The most common adverse events at a rate that was only modestly greater than placebo were nausea and somnolence. In fact, the overall discontinuation rate in the study, which is a good way of assessing how well the medication is tolerated by the patients in the trial, as well as its overall effectiveness, was lower for the Latuda-treated group, about half as frequent as the placebo-treated group with regard to overall discontinuation rate.